Welcome back. Do you have constant pain in your neck, back, or even legs? Well, don't live your life in pain. Live it fully with help available right here in the Valley. Here with the details, Dr. Devin Luzad of Spinal Care of Nevada. Welcome back.
Thanks. Great to be here.
It's great to see you. Now, you practice something called the Nucca Method. What exactly is that?
Well, most people are, when they have concern about going to a chiropractor, they're concerned about getting twisted, cracked, pop, hurt. And the great thing about the Nucca Method is that it's a very gentle type of chiropractic. Been around a long, long time. Getting more and more popular, also considered to be modern chiropractic because it is so very gentle. There's just no way to hurt someone. So we see a lot of folks who've been told, don't go to a chiropractor, or who have been told you have to only have surgery. Folks who haven't gotten help with other conditions. So if you've had chronic pain in your neck or your back, that's normally thought of as going to a chiropractor, but what those things do is it pinches nerves. So it can cause numbness down the arm, carpal tunnel, numbness into the rear end, which is a technical term for it, called sciatica, pain down into the feet, even problems with the joints. So with the Nucca Method, we've been able to get people help chiropractically, avoid surgery, avoid having more shots, even when they've been told there's no hope.
Now, we have some video that shows how you pinpoint the location of the pain. Let's take a look at that, and you can explain to us what we're looking at.
Well, think of it this way. The brain is the power box. It sends the signals down the spine. The nerves that run to the heart and lungs, if those are pinched, it can cause asthma, high blood pressure, pain to that place in your back where you just can't itch or scratch. If you have a pinched nerve into the lower back, it can affect the male organs, the female organs, intestinal tract. That's constipation, diarrhea, sometimes a combination of both. Now, if you have pinched nerve in the back, obviously hip pain, back pain, pain in the legs. How about a pinched nerve at the top of the neck? That's headaches, sinuses, allergies, asthma. You know, a lot of these conditions like high blood pressure or allergies or asthma, you don't consider them chiropractic problems, but there's research that says that the gentle type of work that we do in our clinic can have an effect on it, even though I've never claimed to cure something like irritable bowel syndrome or upset stomachs. When we fix a low back or a mid back, it's amazing how many times months and months later someone says, gosh, you know, I'm breathing better, I'm sleeping better. Sleep apnea, I don't wake up as many times during the night.
Now, for people who have been living with chronic pain for a very long time, I'm sure they come in and they see you. Can you still help them?
You know, we do a 2-day workup, and that's to find out if we can help. I just talked to a gentleman in the lobby, bad sciatica, old basketball player. And if you don't get these type of injuries fixed now, it turns into a surgical conversation. So in our 2-day workup, day one, we're going to sit down and meet with the patient, consultation, history, thorough set of exams, x-rays that likely you've never had done before. Our type of x-rays look at the spine differently. That's day one. Day two, we're going to sit down with the patient and their family. Listen, if we can't help, my #1 job as a doctor is to get you to the right doctor so that you can get the relief you need. If we can help, we're real upfront. We're going to make a game plan. Hey, doc, how long is this thing going to take? What's it going to cost? Does my insurance help out? That's our 2-day workup, and then we'll start to get you some relief.
Now, you practice something also called low-level laser therapy. What exactly is that?
Well, think of it this way, Dow. The Nucca adjustment gets pressure off the nerves, so we help with pinched nerves. The cold laser can go into a bad shoulder. It can go into a bad knee, arthritic hands, arthritic ankles, fascia you know, on the bottom of the foot that's tight and painful, and it can cause more circulation in the area, which helps it heal faster. So Nucca lines you up, gets your head on straight. The laser gets more circulation there.
Now, where's your office?
We have a few offices in the Valley. So in order to get a consultation with us, what we're going to do is we're going to do our 2-day workup, normally $180. We're going to set up the first 20 callers only, and we got to cap it at that amount. We'll do the whole workup for $37.
And to get more information, we go to the website, drdevin.com?
Yes, if you're a web surfer, you can go online. I'm an old school guy. I just use a telephone.
You just call people
566-HOPE. You know, just sweet, loving, caring staff. We're going to get you in if you're the first 20 callers, and if you're beyond that, listen, we'll still help you. You just got to pay the full freight.
Yeah, and I think the important thing to know is, again, people have been suffering for a very long time, and with that injury that they had in high school or in sports or whatever it may be, a car accident, they can get help.
And if you don't get it fixed now, it always turns into something more invasive. So if we can catch it now, it saves you years and years of pain, suffering, and more importantly, your loved ones from suffering.
Exactly.
Because your health affects everybody around you.
It certainly does. Well, thank you so much. Appreciate your time.
My pleasure.
The first 20 callers will get a consult, exam, and x-rays for $37. Normally, that's $180. This is not valid for Medicare-aged patients due to federal guidelines. For more information, just head to the website or call the number listed right there on our screen. We'll be right back.